give her a really warm welcome, please? Well done.
Thank you. Very excited to be here. And what I want to do is share two big thoughts. Why is innovation important, especially when we talk about biopharma? And what do good companies that innovate do? And I want to take those two thoughts for you today. Yes. Cool. Yes. So why should you innovate? So this is a survey that BCG runs almost every year, where we try to rank companies that innovate. And you can see that consistently over the past 20 years, companies that innovate always do much better when we look at total shareholder return. Doesn't matter if it's a time of downturn like COVID, doesn't matter if it's a normal time. Every single year, companies that innovate do exceptionally well. So if that's the truth, what is really, sorry. Can we move to the next slide? If that's true, what is really starking is only 3% of companies are actually ready to innovate. And that's very scary, especially when we talk about biopharma, where billions of dollars are at stake, billions of lives are at stake. And this is very surprising because it is two dichotomies. On the one end, biopharma is the industry where innovation is happening at the fastest pace. I can talk through some of it. Either is it AI and drug discovery, new modalities, the pace of innovation. But on the other hand, what we see is only 3% of companies are actually ready to innovate. And this means that companies that do innovate will be able to get a lion's share of the market. And we already saw that in obesity, that companies that do innovate and persist will always win in this market. And so why is innovation important when we think about biopharma? It's a little complicated slide, but what I want to say is in biopharma, as we go over the past few years, the competitive advantage is very short-lived. On the right-hand side is basically the time between the first and the second new molecular entity that was launched. As you can see, in the 1990s, this took about 15 years, 15 to 20 years. And now it's less than a year, and probably even lower if you think about all the innovation that's coming out of China. And on the left, it's not just about new molecules that are being generated, but it's also about the clinical utility of these. And so what this shows is for each of the indication, how do you actually improve the outcome as new molecules get discovered? And you'll see the sharp trend. Every new molecule that is getting discovered for that indication moves up the outcome. And so what this means is innovation is not going to be a one-time thing. Companies that succeed will have to innovate continuously because that's the pace of innovation that's happening in biopharma. And if you look at the next decade, you'll also see that it's going to be an unprecedented amount of new technologies that's going to come up. You know, we're all used to small molecules. We've moved to biologics where there's less toxicity, but as we move forward, we're already in the personalized curative therapy with CAR-T, gene therapy, ADCs. And this is not where this industry is stopping. There's a large arsenal of new technologies, gene editing, PROTACs, microbiome, that are all going to come up very soon. And so what this does is today, this is only 5% of the pipeline. In the next decade, or actually by 2030, this is going to be 20% of the pipeline. And while traditionally, all of these, sorry, can we go back? Well, traditionally, all of these have been in like small, rare diseases. As we look into the next decade, it's already moving into larger patient population. And if you're stuck in the old ways of simple small molecules, the innovation is going to go ahead. And I want to give one example of one of these innovations. If you take antibody-drug conjugates, which all of you are probably already working on, the thing that's very interesting about antibody-drug conjugates, you know, it's a very toxic payload, antibody that's connected to it, and it's a Trojan horse. And the first antibody-drug conjugate was actually launched in 2000. And already we have about 14 drugs in the market, with majority of them more than $1 billion. And if you look at the axes of innovation in ADCs, it's not one. The axes of innovation in ADCs are around 5 different axes. People are innovating around the targets that were never achievable without using ADCs. They're innovating around the mechanism of action through the payloads that were never accessible to you because they're so toxic are now accessible to you. They're innovating around the carriers. It's not a simple antibody, but it's bispecifics, it's biotropic. And all of these innovations is what is fueling this industry. And that's what makes it really exciting. And innovation cannot, and the other axes of innovation, right, cannot go without talking about AI. And this is a study that BCG did, where if you look at AI-discovered drugs, you'll see that in the left is basically all of the preclinical assets from the top 20 pharma companies. And they are in a declining trend. What you do see is on the right is AI players. And they today contribute already to 50% of the top 20 pharma preclinical assets. The pace of innovation is much rapid when we bring in AI to the picture. And it's very simple. It's because AI-discovered drugs are just today faster and actually reduces the cost of development. And there are a lot of number of proof points that are already in play. And of course, the next 5 years, we'll see the most important proof point as AI-discovered drugs actually improve the probability of success. But what is really exciting is this is not in the paper, right? This is not in somebody's head. This is not a concept. We have worked with companies to actually reduce the cycle time by 25% by embedding AI in the drug discovery workflow, either through changing into structure-based virtual screening or multi-parameter optimization. And this has significant impact on the value chain. Your molecular design time can reduce by 25%. If you expand the impact on the portfolio of a pharma company, this can save them about $100 million. And more importantly, actually open up the aperture to the number of molecules that you can actually be targeting. And so AI and drug discovery is the other innovation that's really going to change the landscape of biopharma. But why are not all companies innovating? Innovation is hard, right? It is not easy, and that is why only 3% of companies today innovate. And there are a lot of issues that companies today face on why they don't innovate. You know, ivory tower, all of the innovation is happening in a small R&D lab. People are not talking to each other. They're not cross-collaborating, and so that innovation remains in that one particular person's head or one particular lab. Or grassroots anarchy, you know, a lot of companies try to push you to do innovation from the ground up. But unless you have a top-down strategy that gets people in the same direction, innovation is not going to go anywhere. And the third one is pretty interesting, you know, killing me softly. If you look at innovation, if you look at the biopharma's pipeline, like I think today 40 to 50% of the innovation is from biotechs. And what they do very poorly, actually, is to tap onto that external innovation. You know, we worked with companies where an internal employee would intentionally sabotage an external innovation because they are only rewarded for internal innovation. So really thinking about how can you tap into that external innovation. And none of this will actually be realistic or achievable unless there's a top-down strategy and persistence in driving that innovation. And I want to leave you with one story of a company that is innovated, and this ties back to our panel on obesity. I think when we think about innovation, none other than Eli Lilly or Novo Nordisk is the company that comes to mind about innovation. They persisted, they had a strategy, and they focused. And we talk about obesity today in 2025, right? But that journey started in almost 100 years back. In 1923, they actually introduced their first diabetes drug, and they committed to innovation in diabetes. And they didn't stop there. You know, in 1990, I think as we discussed, they started exploring GLP-1. In 1990, when it was not even clear that there was a correlation or any sort of connection between diabetes and innovation, you know, that's when they started. And it was not even clear if patients would take a drug that would solve obesity, payers would pay for it, but they persisted. They started in 1990. In 2005, almost a decade later, they introduced the first GLP-1 drug. And it was not until another decade, in 2014, that they actually got their first drug approved for weight loss. And now you see obesity, Wegovy, and Ozempic. But that's a journey that started almost 100 years back with a strong strategy, focus, persistence in the face of failure to drive innovation. So thank you so much. Very exciting to share a few thoughts on innovation and hope it was helpful.